We're here in Kuntaya in North Bank. This year, the Cancer Association League, the Gambia, our commitment is to join organizations here in the Gambia in the fight against cancer. So every year we target a community to go to and sensitize, as well as do a 2-day medical mission. So that's what brings us here in Kuntaya.
We really encourage every community to embrace and encourage the cervical cancer and breast cancer screening. It really shows that we are together in this, and we are together in the fight against breast and cervical cancer in the Gambia.
As we go into these communities, what we're finding is that women have a challenge to really come out, to really do these checks, because they're afraid that when they know they cannot impact it or they don't have the financial responsibilities to go and seek treatment. And also because of the fact that there's not enough resources in the country for these women to get diagnosed, which is to a mammogram machine where women can go and get tested, or there's no radiotherapy machine. So they don't have the resources to seek medical attention internationally, so they give up.
Don't stay silent. You need support. You cannot do it by yourself. It is a taboo in Gambia when you're sick to hide your sickness. Come out and talk to people.
With this testing and counseling, it's really important in women's life, because every year it kills thousands of women.
I've seen women in this screening who has never been screened, and women who have never heard anything about cervical cancer and breast cancer, and today they are here.
From today, I believe so many women who came here will know about cervical cancer. They will be provided with the knowledge, and the information is very important, because if once you know the risk factors that you need to know for you to be tested and the age at which you should be routinely tested, it's important. The women will now, from now on, we advise them every year they will come for the screening individually. And the other part is the breast cancer screening. We usually give them a leaflet. So that leaflet can be used to self-examination. So the women can use that leaflet after each period, after each menstrual period, they can use that leaflet to do a self-examination of the breast. So if they see any abnormality, we are advising them to come to the facility so that further investigation can be done.
Through experience, I already lost 2 sisters through this disease. And I'm appealing to everybody, every woman, to come and get tested and get counsel.
How to prevent breast cancer is coming for screening programs like this. The one that we are currently doing, the Ministry of Health is currently collaborating with the Cancer League to organize a free screening. We know that health is not free. This screening has been funded by the Cancer League. They paid everything for all the women, so we want the women to come and get screened, because the early sign of breast cancer can be as simple as a small lump in your breast, a very painless lump. You just see it in your breast and feel that I'm okay, I don't have breast cancer. Whilst it will be growing slowly. The moment it starts fading, you know that now it has turned to cancer. And the unfortunate part of it is cancer can be managed in the Gambia when detected early.
One of the things that is really important for the League is the fact that the transfer of knowledge, that when we bring these amazing doctors, oncologists and gynecologists and radiologists from Dakar, is also to be able to transfer that knowledge to our medical practitioners here in the Gambia. Because when these people go back to their communities, they're able to use the knowledge that they have gained with the doctors that are with the visiting doctors. So that's one of the things that as a league, we're most proud of. This fight is ours. Together we can, and cervical cancer and breast cancer being the #1 killer of women in our communities, it is our responsibility. And how do we empower women is to really make sure that we come together, we fight together, and in partnership with the Ministry of Health and the government as well. So I thank everybody for coming here, and also I am taking this opportunity to thank our sponsors, because without whom we would not have been able to make these events a possibility.
It is indeed a pleasure for Comium to partner with the Cancer League Association of the Gambia to support spread the awareness, increase the sensitization to help our women, to help our sisters, our ladies do their screening, know their status, in order for them to be able to know what's their status, and then in case of anything, they will be able to get the right counseling and treatment on time.
We've trained midwives across the Gambia in all the regions on breast cancer screening and cervical cancer screening. So now we encourage every woman to visit the health facilities. Now every facility is doing these services, both breast and cervical cancer screening.
I have seen a significant growth in breast cancer awareness. Now everything is Pink in October, from the TV stations to the businesses to government offices. Everybody is hopping on the breast cancer awareness bandwagon. But we still need to do more as far as our hospitals go, as far as the healthcare system goes, to encourage screening to help women when they're sick, but also provide more health, more cancer care facilities for women when they get diagnosed.
Because we know that women's health is a priority to everyone in the government as well. But we need radiotherapy machines. We need to have mammogram machines in the Gambia. So when women would like to test themselves, know their status, they will have a place to go to. Because most of these women, we do not have a radiotherapy. We don't have oncologists in the country. So it makes women have to travel abroad or to Senegal to seek medical treatment. So how about women that are actually who cannot afford to seek treatment abroad? We have to make sure that we have a health care system that is very powerful, that is strong for our women to be able to go to if they need support when it comes to their health.